Welcome to today's video about early signs of colon polyps. Most colon polyps grow silently, without symptoms, which is why screening saves lives. However, some polyps do send warning signals before becoming cancerous. Understanding these 9 early signs could help you catch a problem when it's still preventable. According to NCBI research, most polyps are discovered during routine colonoscopies because they cause no symptoms, which makes regular screening essential after age 45. When symptoms do occur, they're often subtle and easily dismissed. Today we're examining 9 evidence-based warning signs supported by research from the Mayo Clinic, Cleveland Clinic, and National Institutes of Health. Let's explore what your body might be telling you. All right, here's the list of early signs of colon polyps. Let's begin with number 1, rectal bleeding. Rectal bleeding is the most commonly reported symptom when colon polyps cause problems. According to NCBI research published in the StatPearls database, patients may present with painless rectal bleeding appearing bright red or dark red in color. You might notice blood on toilet paper when wiping, or see blood in the toilet bowl that hasn't mixed with stool. The National Institute of Diabetes and Digestive and Kidney Diseases confirms this as a potential polyp symptom requiring medical evaluation. Bleeding occurs because polyps become irritated as stool passes through your colon. Research published in the Journal of Clinical Gastroenterology found that bleeding risk factors include polyps larger than 1 centimeter, those attached by a stalk, pedunculated polyps, and polyps with certain color characteristics, such as cherry red appearance. The bleeding is typically painless, which distinguishes it from conditions like anal fissures that usually cause sharp pain during bowel movements. Bright red rectal bleeding indicates blood originating from the lower digestive tract that hasn't traveled far through your system. While hemorrhoids are the most common cause of this type of bleeding, medical studies emphasize that anyone over 40 experiencing rectal bleeding needs proper evaluation. Research published in The Lancet found that among patients over 40 with recent rectal bleeding, polyps were discovered in significant numbers, making colonoscopy the appropriate diagnostic tool rather than assuming the cause is benign. Next, sign number 2. Blood in stool or black, dark stool. When blood mixes with stool during digestion, it undergoes chemical changes, altering its appearance dramatically. Mayo Clinic reports polyps can cause dark or black stool, called melena in medical terminology. This differs substantially from bright red bleeding because the blood has traveled further through your digestive system and been partially digested by stomach acid and enzymes. Cleveland Clinic research shows bleeding from polyps can occur so slowly you never see obvious blood. Instead, stool may appear very dark, almost black, or have a tarry consistency and distinctive odor. Medical research confirms this bleeding type often indicates polyps located higher in the colon rather than in the rectum or sigmoid colon. The challenge is many people don't immediately associate dark stool with medical problems requiring attention. They may attribute it to iron supplements, bismuth-containing medications like Pepto-Bismol, or foods like black licorice or blueberries. However, unexplained dark or black stool persisting beyond a day or 2 deserves medical attention regardless of potential dietary causes. Stanford Healthcare emphasizes that bleeding from polyps, whether bright red or dark, should always be evaluated professionally. Blood presence in any form indicates something in your digestive tract needs attention, and only proper diagnostic testing can accurately determine the source. Next, sign number 3, change in bowel habits. Persistent changes in bowel habits lasting more than 1 week can signal colon changes. Mayo Clinic research shows this symptom manifests as new-onset constipation or diarrhea, representing departure from your normal pattern. These changes are among the most common symptoms when polyps do cause problems. NCBI StatPearls confirms that bowel habit changes are among polyp presentations. These occur because larger polyps can partially obstruct normal stool flow through your intestine. Research indicates that polyp location and size influence the type of change experienced. Constipation may develop when a polyp creates partial blockage, making stool passage difficult through that colon section. Conversely, diarrhea can occur as the colon attempts moving stool past obstruction. Medical research emphasizes duration importance. Occasional irregularity is normal, but changes persisting beyond 7 days warrant evaluation. The National Institute of Diabetes and Digestive and Kidney Diseases states that constipation or diarrhea lasting more than a week should prompt doctor contact. While many conditions cause these changes, persistent deviation from your baseline is key. Research shows people often wait months before seeking help, but earlier evaluation could identify polyps before progression. Next, sign number 4, mucus in the stool. Your intestines naturally produce mucus, helping stool move smoothly through your digestive tract without causing irritation. However, increased mucus production can indicate colon irritation or structural changes. Mayo Clinic research shows some polyps, particularly larger ones or certain types like villus adenomas, can trigger increased mucus secretion. Mucus may appear as clear or whitish, jelly-like substance mixed with stool or visible separately on toilet paper or in the toilet bowl. NCBI notes that while some mucus is normal in everyone's stool, noticeable increases in amount, especially when occurring alongside other symptoms like bleeding or pain, may link to colon polyps. Medical literature explains mucus production increases as a protective response when colon tissue becomes irritated by any abnormal growth. When polyps are present, surrounding tissue may produce more mucus defensively to protect the intestinal lining from potential damage. Gastroenterology research indicates certain polyp types, particularly larger sessile polyps, are more likely to cause this symptom than small pedunculated ones. Cleveland Clinic emphasizes an important distinction. Occasional small amounts of mucus aren't concerning at all. What matters is a noticeable change from your normal pattern or mucus appearing regularly over an extended period. Studies show when mucus occurs with other warning signs like rectal bleeding or changes in bowel habits, seeking prompt medical evaluation becomes more important to rule out polyps or other intestinal conditions. Next, sign number 5, iron deficiency anemia. Iron deficiency anemia may seem unrelated to your colon, but research shows a crucial connection. According to studies published in PubMed Central, when polyps bleed slowly over time, even without visible blood in stool, they can gradually deplete your body's iron stores, leading to anemia. This microscopic bleeding often goes completely unnoticed. The symptoms of iron deficiency anemia develop gradually and insidiously. Fatigue that doesn't improve with rest, shortness of breath during activities that previously didn't bother you, weakness, dizziness, pale skin, heart palpitations, and even unusual cravings. Cleveland Clinic research confirms that chronic bleeding from polyps can manifest as these anemia symptoms before any blood is visibly detected in stool. Medical studies reveal striking statistics. Research published in Healthline found that anywhere from 30 to 75% of people with colorectal issues may develop iron deficiency anemia. A study in PubMed Central showed that men and postmenopausal women with unexplained iron deficiency anemia had significantly increased risk of gastrointestinal lesions, including polyps. According to research from the Agency for Healthcare Research and Quality, iron deficiency anemia in adults, particularly those over 45, should prompt thorough gastrointestinal evaluation, including colonoscopy. The New England Journal of Medicine published research showing that among patients with iron deficiency anemia who underwent colonoscopy, a significant percentage had colon polyps as the bleeding source. This microscopic, ongoing blood loss is why anemia becomes one of the most important clues that polyps may be present. Next, sign number 6, abdominal discomfort or cramps. Abdominal pain from colon polyps typically manifests as cramping sensations or feelings of pressure in your belly. Mayo Clinic research shows that when polyps grow large enough, they can partially obstruct your colon, causing the intestinal muscles to work harder, moving stool past the growth, which creates cramping discomfort. NCBI Stat Pearls lists abdominal pain among the presentations of colon polyps when they become symptomatic. Medical research indicates the discomfort is usually crampy in nature rather than sharp or stabbing, and it may be intermittent rather than constant. The location of the pain can sometimes provide clues about where a polyp might be located within your colon. Cetus Sinai confirms that cramps and abdominal pain can occur when polyps reach a certain size threshold. The pain often relates to bowel movements and may worsen after eating as your digestive system becomes more active in processing food. Studies show larger polyps, particularly sessile polyps, which have a broad, flat base rather than a narrow stalk, are more likely to cause this symptom than smaller, pedunculated polyps. Medical literature emphasizes polyp-related abdominal discomfort is typically persistent rather than fleeting. People tend to dismiss it for weeks or months, attributing it to stress, dietary indiscretion, or normal digestive upset. Cleveland Clinic research indicates persistent abdominal discomfort that doesn't resolve on its own deserves medical evaluation. Research also clarifies that polyps rarely cause severe, sudden pain. Intense abdominal pain with fever or vomiting suggests different, more urgent problems requiring immediate medical attention. Next, sign number 7, change in stool color. Beyond black or tarry stool, any unexplained stool color change can signal digestive tract problems. Medical News Today, citing peer-reviewed research, notes stool color changes can occur with colon polyps. Your stool's normal brown color comes from bile, produced by your liver and processed through your digestive system. When polyps bleed intermittently or in small amounts that don't create obvious visible blood, they can still alter stool appearance in subtle ways. Research indicates you might notice reddish streaks running through the stool, unusual color tints, or general shade changes that differ from your normal pattern. Medical studies emphasize ruling out dietary causes first before assuming medical significance. Foods with strong natural or artificial coloring, such as beets, red gelatin, or foods with food dye, can temporarily change stool color. Iron supplements predictably darken stool to greenish-black. However, color changes occurring without clear dietary explanation that persist or recur regularly warrant medical evaluation. NCBI research shows people notice subtle variations but hesitate reporting them to doctors because the changes seem too minor to mention. However, gastroenterology research confirms unexplained persistent stool color changes should be evaluated, as they can provide important diagnostic clues. The National Institute of Diabetes and Digestive and Kidney Diseases advises contacting healthcare providers if you notice persistent changes in stool color. Research indicates consistency matters significantly. Brief changes lasting a day or two after eating colorful foods aren't concerning, but unexplained, persistent, or recurrent changes warrant professional assessment. Next, sign 8, feeling the urge to pass stool with incomplete evacuation. This symptom involves feeling like you need a bowel movement, but when you try, either nothing happens or you feel incompletely emptied. MD Anderson Cancer Center notes large polyps can cause the sensation, called tenesmus. The mechanism involves your rectum's sensory system. Your body normally signals when stool is present in the lower rectum, triggering the urge to have a bowel movement. Research indicates when polyps grow in the rectum or lower colon, especially if large, they can stimulate these sensors even without stool present. Medical studies show this symptom is more common with larger polyps or those in the rectum and sigmoid colon, the lower large intestine portions. Gastroenterology research indicates people describe this variably: constant bathroom need without being able to go, persistent rectal fullness, or frustrating multiple bathroom trips without feeling finished. Cleveland Clinic research notes this symptom significantly impacts quality of life. People experiencing persistent tenesmus become anxious about bathroom access and may wake multiple times nightly. Medical literature indicates when this occurs, especially in people over 45, thorough evaluation is warranted because polyps causing the sensation often require prompt removal. Next, sign number 9. Being over age 45 to 50 with risk factors. While age isn't technically a symptom, it's your most significant risk factor for colon polyps. The U.S. Preventative Services Task Force 2021 guidelines recommend screening begin at age 45 rather than 50 for average risk adults. JAMA research showed colorectal cancer incidence in 45-year-olds today equals the incidence in 50-year-olds back in 1979 when screening first began. Kaiser Permanente studies involving thousands of participants confirmed adults aged 45 to 54 have similar polyp rates as those aged 50 to 54. The American Cancer Society first lowered the screening age to 45 in 2018 based on evidence that colorectal cancer risk at younger ages was increasing. Subsequent research confirmed that the benefits of earlier screening outweigh the harms. Age becomes even more significant when combined with other risk factors. These include family history of colon polyps or cancer, inflammatory bowel disease like Crohn's or ulcerative colitis, obesity, type 2 diabetes, and smoking history. The National Cancer Institute confirms 30% polyp prevalence in people over age 50. Medical research is unequivocal. If you're over 45, screening is essential preventative health care regardless of whether you have symptoms. The 9 signs discussed are supported by research from the Mayo Clinic, Cleveland Clinic, National Institutes of Health, and peer-reviewed journals. However, remember, most polyps cause no symptoms. Regular screening beginning at age 45 is essential, even if you feel healthy. The American Cancer Society and U.S. Preventative Services Task Force confirm that screening saves lives by catching and removing polyps before they become cancerous. Research shows over 95% of colorectal cancers originate from polyps. When polyps are found and removed during colonoscopy, cancer is prevented. If you are experiencing any symptoms discussed or are over 45 without screening, schedule an appointment with your healthcare provider. Early detection remains your best defense. If this video was helpful, kindly type "helpful" in the comments. Your feedback encourages more evidence-based content. Please like, share with family and friends, and subscribe for more research-backed health education. Thank you for investing in your health today.